Around the world, the demand for health workers is growing. The World Bank predicts 40 million new jobs will be created globally in the sector over the next 15 years, mostly in wealthier countries. For many, this increased demand brings with it the opportunity to take their valuable skills to work in another country, where they may find greater job opportunities, better working conditions, or higher salary. In response, in 2010, the member states of the World Health Organization adopted the WHO Global Code of Practice on the international recruitment of health personnel.
Support from the European Union and Norway has allowed us to target implementation of the code in 5 countries and globally. The results have surprised us. They provide a new and dynamic understanding of health worker migration, with substantial intra-regional south-to-south and north-to-south movement that complements better understood movement of health workers moving from the global south to the global north.
Uganda was one of 3 African countries which received targeted support to implement the WHO Global Code. Here, as in other countries, the issue of health worker migration was shown to be more complex than many had assumed.
The Brain Drain, Brain Gain project enabled us to look into inflows and outflows of health workers, and what we found, to our surprise, is that about 33% of all the new entrants on the register are doctors and nurses from abroad. And we asked ourselves, who are these people? What are they doing in Uganda?
Dr. Shalini Samson is a radiologist. She came to Uganda from India to study and has stayed here to practice. Her experience speaks to the surprising diversity in destinations for Indian-trained doctors and also to the globalization of medical education.
I was an undergraduate doctor. I did my first degree in India from Bangalore University, and then after finishing that I came here. I got the opportunity to do masters in radiology, so I did that here, and then I stayed here as a radiologist, and I started practicing here. If I had to go back to India, I had to do another degree there in order to practice, or maybe works for some more time, but then here I could just straight away start working.
Dr. Samson has witnessed much of the growing trend for health worker migration firsthand, which she believes has wide-ranging benefits.
In India, there are too many doctors, and then the pay there is not so good as compared to the work they get. So the work is too much and the pay is less. Quality of life just goes down. So they would rather go to some other countries for business, okay, for ease of life. And then there is this another part, helping out.
The mobility of health workers around the world is a trend that will keep growing. However, if better supported and managed, it can provide significant benefits to countries and to the health workers themselves. The findings from Uganda pointed to significant movement within the continent. In total, around 30% of health workers trained in Uganda migrate abroad, but rather than heading to Europe or America, it seems many are staying in the region.
They go to Kenya, they go to Zambia, they go to Botswana, they go to Namibia. Not so much to Europe or America.
Dr. James Enoguh studied in Uganda, but his training also took him around the world. After he graduated, he decided not to return to his home country immediately, instead settling for a time in Rwanda.
I migrated pretty much after I qualified as a specialist in radiology. I tried to work in Uganda, but the economic situation was tough then, and the nearby country, Rwanda, was coming up. I returned to Uganda again. When I stayed there 10 years, I realized I'd raised enough capital. I could go home and buy some of the equipment and start on my own, and that's what I did.
Among the many complications involved in monitoring health workforce movement, temporary migration is increasing in importance. Health workers travel abroad for limited periods, often to neighbouring countries within the East African region, where regulations are increasingly being harmonised to make the maximum use of the health workforce across country borders.
We do realize that the number of doctors within the region is quite limited, and therefore we want to encourage free movement of doctors within the East African states. And that definitely is a good thing. And it also allows us to train more and therefore share the little that we have.
These regulation changes also apply to refugee doctors, a small but significant segment of the health workforce.
These are guys whom they have fled their countries most of the times, and they may not have all the documentations that is required for a normal registration. And therefore, we waive some of those. And of course, those who are going into refugee countries, they are required there, and therefore they try to make it as fast and as smooth as possible.
The WHO Code on the International Recruitment of Health Personnel is going to be a very important tool going into the future. Health worker migration is going to assume significant proportions. And the reasons are that developed countries, their populations are aging. They are looking for more treatment and more nursing services and more medical services. At the same time, they do not have sufficient young people among their populations to recruit from. They are going to be looking for other sources to fill this gap, and they are going to turn to countries like Africa, Uganda. The code, therefore, will provide a tool for which this migration movement of health workers can be done. So the code, I think, was a terrific achievement for global health, and I look forward to seeing it being used more and more by more countries.
A key lesson from the project has been the importance of improved evidence to both better capture the complexity of health worker mobility and to enable policies that maximize benefits from this movement. WHO, with our partners ILO and OECD, have been mandated to establish an international platform on health worker mobility to accelerate work in this area. Together, we expect the international platform to serve as an important mechanism in the years ahead that will advance national action and international cooperation on this fundamental issue.